My name is Cuilin Zhang. I'm a professor at the Department of Obstetrics and Gynaecology. I'm also the founding director of the Global Center for Asian Women's Health, physician scientist and a clinical epidemiologist working in the field of diabetes and obesity. Diabetes has become a global epidemic, and the majority of patients actually die from these complications. So it's really become critical and important to identify modifiable factors that can contribute to the early prevention of diabetes. Women who develop diabetes in pregnancy, sometimes we call it gestational diabetes, they are at exceptional high risk for developing type 2 diabetes. So in our work, we target at these women in particular and to identify potentially modifiable factors that can help to reduce their future risk of type 2 diabetes. Asian population account for a large percentage of the world population, but if you look at existing data, clinical trials, or existing genetic database, very few target at the Asian population. To address this big knowledge gap, it's really important to have a strategic plan, recruiting researchers from all over the world and try to address major health issues. And for us, we are particularly interested in women's health. But I always ask myself the question, how our findings can really benefit real people, the real world. So we are interested in identifying potential modifiable factors that can contribute to the prevention of type 2 diabetes among this particular group of women at high risk. Modifiable factors like dietary factors, nutrition factors, like exercise, physical activity, weight control, and smoking, like cigarette smoking control. For all these factors, their risk for type 2 diabetes can be lowered by 90%. 90%. I think this is really important message to these women at high risk. Never give up. If they can adapt healthy diet and lifestyle, and then they try to control their weight, they can decrease their risk for type 2 diabetes substantially. I feel this is really helpful and encouraging and real-world message to these women at high risk.